I'm so excited for tonight's presentation, as I'm sure all of you are. Quite a hot topic of discussion. And
hot night.
Was it on a hot night? That's right. And so I get the privilege tonight to introduce our presenter, Dr. Mark Crowell. And a quick story about Dr. Mark and how the two of us met. We actually started chiropractic school together. And I was in the back of the classroom. And there was this one individual that during every class, whether it was anatomy, physiology, biochemistry, always had his hand up. And he was always asking questions. And it was a little bit obnoxious, but they were always good questions. And things I never would even think of. And that's how he thinks, and he is not afraid to ask a question. And that's what makes him such an incredible doctor, an incredible chiropractor, is because he's inquisitive. He's always asking the right questions. And so with this topic, it's awesome because he's passionate about it, and I'm excited to learn from him. And so without further ado, I give you Dr. Mark Crowell.
That was awesome. I was that guy, always asking questions, right? So your life, your outcomes, your health is always about asking the right questions. And that's so funny that Tyler mentioned that tonight, because that's going to be a lot about what we're talking about tonight, right? Are we asking the right questions? So anyways, I recognize all of you guys. I'm so glad that you're here. It is a great honor to serve you guys on a weekly basis and to see your smiling faces and the stories that you share, right? And the laughs that we have. And we're really growing together, okay? So we really appreciate you guys coming out tonight and being here for our topic of discussion, which tonight is going to be on the topic of attention deficit hyperactivity disorder. So right off the bat, I can tell you that for a lot of people, this is a very emotionally charged topic, right? It's an emotionally driven topic for a lot of people and for a lot of families. There's debate within it, right? A lot of people have their own opinions about what attention deficit hyperactivity disorder is. And so the reason why it's so emotionally charged is because primarily we're talking about kids. We're talking about our children and the health of the children, right? And how they fit into society, how they fit into the family unit, right? And we're talking about their behavior, okay? So, you know, any of you that have kids, and I know that's a lot of you in the room, you know that your children and their behavior has the potential to set the tone for a household, right? To set the emotion for a household and the feel of a household. So I know that it's an emotionally charged discussion tonight. But I want to share my heartbeat. The reason why I chose to share this topic tonight for this workshop is the same reason that I decided to become a chiropractor. And so I want to share with you the reason why I became a chiropractor. One simple reason. And I'm going to use this illustration to demonstrate that reason. So you guys know what this is, right?
Acorn.
It's an acorn, exactly. And what does an acorn become?
Oak tree.
An oak tree, exactly. You guys are so good. What happens if I take this acorn and I just throw it on the ground over here, right there on the carpet? What's going to happen to this acorn?
Someone's going to step on it, and that's the end of the acorn.
Okay, that's the end of the acorn, exactly. Someone could step on it, it could rot, right? It could begin to mold, but you know, really nothing's going to happen with the acorn. Now what happens if I take the same acorn and I place it in the proper environment, and it's got the right nutrients, it's got the right soil, there's the right amount of sunlight getting to it, okay? There's the right amount of moisture getting to it, right? And we're blocking out toxins and pollutants, right? What's going to happen to that acorn? It's going to grow into a mighty oak tree. Exactly. Thank you, Sarah. Right? So it's going to grow and it's going to flourish into an oak tree, right? But there's no difference in the acorn whether it's sitting there or if it's in that right environment. There's no difference in the acorn, right? The acorn is the same. It has the brilliance already in it. It has the potential in it to create life and to flourish, okay? So it's the same with humans, right? And that's really the heartbeat behind tonight. It's about potential, okay? It's about human potential, pediatric potential, okay? So when I became a chiropractic patient, I began to see entire families in the office focus on potential
and get off medications that they weren't even going to a chiropractor to treat or to get off of, right? So the chiropractor focused on building health potential, and as a result, families were healthier financially, spiritually, physically, mentally, emotionally, right? It's easier when you're not having to purchase medications for an entire family, right? All right, so those are the things that I began to see as a chiropractic patient. So that's really the heartbeat of tonight, right? So as chiropractors, we're not concerned as chiropractors in becoming masters of any particular disease or disorder, right? We're concerned with becoming masters of human potential, right? So we could focus on a particular disease and a particular disorder, and we could see some changes in that and benefit in that, but that person doesn't necessarily get healthier overall, right? Or chiropractically, we can focus on a person's potential and strive for them to reach their potential, and then naturally what we see is that those disorders and those diseases begin to wane, and they're healthier, much healthier overall. So we're all about building health, okay? So we're not concerned with treating a sickness or disease, we're concerned with building a health. Is everybody with me? Perfect. So this is the September edition of our Body Signals workshop, okay? So we say body signals because we want you guys to start thinking differently about your symptoms, right? We want you to start thinking differently about the symptoms that you experience, that your family experiences, okay? We want you to start thinking differently about the way that you treat those symptoms. So we want you to ask the question, why am I feeling this way? What's wrong with me? And what do I need to do to correct it? Rather than, I hate that I'm feeling this way. What do I have to do to stop it? Because there's a lot of different ways to stop your pains, your aches, your runny nose, your allergies, right? But not all of those ways are actually going to drive you towards health. Make sense? Good. So just to review, the top of this iceberg right there, that represents your symptoms. Okay, that's what you're experiencing. Okay, that's the disorder, the disease, the symptoms that you're currently experiencing. The other 90% below the water, right? That's the problem that's been brewing for a long time that you didn't even know was there, right? So we've told you guys before, we're going to tell you tonight, and we'll tell you again in the future, right? We see that symptoms occur at the end of the problem, not at the beginning of the problem, okay? So it's the same thing with diabetes, with allergies, with asthma, with heart problems. It's the same thing with attention deficit hyperactivity disorder, okay? ADD is a symptom of a bigger problem. Okay, it's a symptom of a bigger problem. So we'll begin our discussion on ADHD by first classifying it. Let's know and come to an understanding of how they diagnose ADHD. And it's not ADD. So we threw away ADD, that term, attention deficit disorder, back in 1994. It's been ADHD ever since. So there's a hyperactivity component into it, and it's broken into 3 types. There's predominantly inattentive type, there's predominantly hyperactive impulsive, and then there's a combined type where those come together. And what's interesting is that what's different about tonight's discussion than all the rest of our body signals is that there's no objective test to actually diagnose attention deficit hyperactivity disorder. There's no objective test like everything else that we did. So the National Institute of Health says that we don't have an independent test for ADHD, and there's no data to indicate that ADHD is due to a brain malfunction. Okay, there's no data to support that. So what we're dealing with is primarily opinions and a checklist of behaviors to diagnose attention deficit disorder. And these behaviors, it's a classification system that any of us at any time could be placed into, right? So let's look at those really quick. What's the criteria for diagnosing ADHD? And you guys had a handout, so I'm gonna go through this quickly. Fails to give close attention and makes careless mistakes. Difficulty sustaining attention. Does not seem to listen when spoken to directly. Easily distracted by extraneous stimuli. Difficulty organizing tasks, fails to follow through, avoids tasks requiring sustained organization, loses things needed for tasks, often forgetful in daily activities, fidgets, squirms, leaves the seats, runs or climbs excessively, difficulty playing and leisure activities quietly, on the go, driven by a motor, talks excessively, blurts out answers before questions are completed, difficulty waiting turn, interrupts or intrudes, right? So some of those symptoms need to be present before 7 years of age, And some of those symptoms need to be present in one or more settings, right? So either at school and at home, or at a wedding, or at a restaurant, and one or more settings. And it needs to interfere with functioning and not part of another syndrome. So who does that sound like? 95 to 99% of all kids that I meet, right? Heather Gallant and Dr. Derek Gallant, they've got a child that won't sit still. He's constantly playing tag with me, and I love it. It's great because I love to move too, right? But he's on this, He's on this. And so technically speaking, we're not dealing with a disease or disease process. We're dealing with a behavior or a misbehavior, okay? And so when you're diagnosing behavior, it can get really fuzzy, right? It can get really fuzzy and really political. So let me give you an example of that. In the mid-1800s, when slaves were running away for freedom, they were diagnosed by psychiatrists at the time with a mental disorder called drapetomania. Drapetomania, from the root word drapetes, which means a runaway, and mania, which means frenzy. So because they were trying to run away to freedom, they got diagnosed with a legitimate disease, meaning a runaway frenzy, right? So another example, in the late 1800s, early 1900s, when we were coming out of the male-dominant era and women were stepping up and coming out from that authority and that male dominance, women were diagnosed with a mental disorder, and it was called hysteria, and specifically female hysteria. So hysteria literally means wandering womb. So they thought that the womb was a creature that got loose and went through the body and caused all kinds of chaos, right? Crazy. Now, thankfully, we don't use these diagnoses anymore, right? So the question is did these individuals really have a disease process? Or were they just not meeting society's expectations, right? So it gets really fuzzy and can get really political, right? When you're trying to form a culture, trying to form a society, right? Conform, all right? So let me just talk about why I think it's important that we recognize that these are fuzzy. These are really fuzzy or possibly political diagnosed practices. So the Diagnostic and Statistical Manual for Mental Disorders is where this diagnosis lies, okay? I'm not going to go through all this, but what's important is that in 1917, it had 22 diagnosed mental disorders. That grew tremendously to now we have over 300 diagnosed mental disorders. Have our genes changed that much? We have that many more people with mental disorders walking around? What's important about this is this manual is formed by the American Psychology Association, and it's made up of 27 task force members. All right, so these 27 people get together and they decide what's going to be included in this. Okay, what diseases are going to be included in this manual. 19 of those 27 people have direct ties to pharmaceutical companies. They have direct ties to pharmaceutical companies. All right, so what happens is you've got these 19 people making diagnosis in a book that's growing so that pharmaceutical, and keep in mind, in order to prescribe a medication, you have to first have a diagnosis. Okay, you have to first have a diagnosis. So you've got these 19 people filling up the diagnoses in this manual so these pharmaceutical companies can come on and prescribe drugs. All the while, those 19 people are getting a kickback from the pharmaceutical company, right? It just seems like a conflict of interest to me. That's all I'm going to say about it. I'll let you guys talk about it. So what are the trends with ADHD? What are we seeing? So in 2003, 4.4 million children were diagnosed with attention deficit hyperactivity disorder. In 2007, that grew to 5.4 million children diagnosed with attention deficit hyperactivity disorder. And that's the last bit of data that we have on that, okay? But over the last decade, we saw a 5.5% annual increase in the rates of diagnosis in children. And so we can safely estimate that in 2010, and this has been reported, that there's 6.3 million children diagnosed with attention deficit hyperactivity disorder, right? And in 2013, we're estimating that there's 7.5 million children diagnosed with attention deficit hyperactivity disorder. Crazy, right? So prior to 1980, we had 1% of our children were diagnosed with ADHD. Currently, 10% of our children. We went from 1 in 100 to 1 in 10 children. In high schools, it's 1 in 5 children diagnosed with attention deficit hyperactivity disorder. All right? This is roughly a 55% increase over the course of a decade. So what are we doing to treat this disorder? Well, there's psychotherapy, there is neurobehavioral therapy, but the primary mode of treatment for this is medication, right? Because it's easy, it doesn't take any time, right? It's a little bit cheaper because it's less one-on-one time with a professional. It's a really easy route, for families to go. Medications like Ritalin, Adderall, right? So in 1990 to 1996, there was a 500% increase in prescriptions handed out for ADHD. That's a huge increase, guys. Currently, 66% of children with ADHD have a prescription, have a prescriptive drug. 66% of them, right? So we can see that that is the primary therapy. So in 2007, that means it equates to 2.7 million children on medications for ADHD. And we can estimate that currently there's 5 million children in the United States that are taking these drugs for ADHD. Why does this even matter? Why is it important? Because these drugs are amphetamines, and they're methamphetamines. The Drug Enforcement Agency puts them in the same classification as cocaine, morphine, and opium. Why? Because they're the most addictive drugs that are out there. So what happens during the formative years for a child when their neurology is forming, when the brain is learning what's normal and what's right and what's abnormal and what's not right? You put these kids on these drugs, they're craving stimulants. So when they get off of these drugs and they get into adulthood, the research says that they're twice as likely to develop a cocaine addiction. Twice as likely. All right? And what do we know? That the benefits of these drugs are shown to dissipate over the course of 3 years. So some of these kids are 2 years old when they're getting on these medications. And so all we're doing is teaching them to crave, the brain to crave stimulants, and then 3 years later when they're 5 years old, they're back at square one. Only they had this addiction to stimulants, right? So 23,000 visits to the emergency room were caused by properly prescribed drugs. And the reason why we're prescribing these drugs to kids is to improve academic outcomes. Okay, it's to improve academic outcomes. There's not one bit of literature out there to state that it's doing that, right? Not one bit of literature. It does great. These drugs do great at controlling behavior, at suppressing misbehavior, at increasing focus and attention, right? Improving cognition is where that comes from. It does great at that, right? But that's not even our goal. We're just suppressing their behavior and controlling their behavior with no real benefit. No real benefit. Animal studies that we've done with these same drugs show that when animals are given these drugs, it knocks the spontaneity right out of them, right? So the animals stop socializing with one another. They stop playing with one another. They stop being curious about their environment. They stop trying to escape, right? It's like a chemical straitjacket for the animals. It's controlling them. It's not leading to their growth. The same thing has happened to the kids, to these children. All right, so what are we teaching them to by taking medications? We're teaching our children that there's something wrong with me and the only way to get well is to take a medication. That's my answer. It's an easy route, it's going to fix me. It's the wrong message, right? School nurses are handing out more medications than mental hospitals, right? Our medications, they're flavored, right? So they taste good on the way down. And there's tons of side effects, right? They have these big black box labels on these drugs. So there's heart problems, there's homicidal ideation, there's suicide attempt, there's aggression, there's anxiety, there's insomnia. The list goes on. Those are just the most common things that we're seeing as side effects from these drugs. And lastly, 20% of the drugs that are being prescribed to these drugs are being redistributed. This is in the literature. We know rates of kids that get caught with Adderall, Ritalin, right? I went through college. I know kids that had it, So we know it's being distributed. Okay, this stuff gets documented. And so medications are used to manipulate genes, right? They're used to manipulate genes. So we've had these genes passed down to us over thousands of generations. Have our genes changed that much? Do we really have a gene problem? Right? Have they changed that much to see the rates go from 1% to 10%? It just hasn't happened. Okay? So Leon Eisenberg, who's a great contributor to the psychiatric profession, right? He's got countless research articles that's in peer-reviewed literature, okay? He's considered the father of ADHD, one of the main developers of it, and he was the chief psychiatrist at Johns Hopkins Hospital. He's the chief psychiatrist at Massachusetts General Hospital, and he was a professor at Harvard Medical School, right? So a pretty prominent person in the profession. During his last years, he warned us of the overdiagnosis of ADHD. He warned us of that. And he encouraged us to look at the real reasons, the real causes of behavioral problems, right? One of his last statements is ADHD is a prime example of a fabricated disorder. The genetic predisposition to ADHD is completely overrated. From the father of ADHD, right? Huge, huge in the psychiatric profession. So was he saying that ADHD is not real? Absolutely not. It is real. We know some kids are over the top. They do have these attention deficit hyperactivity disorders. That's fine. We know that. But is it at this rate? That's the question that we have to ask, right? So the question you guys should be asking right now as chiropractic patients is can chiropractic help these kids? And how does it help these kids? Right? So we have to dive into chiropractic philosophy, right? There's got to be a better way, right? We see that that's a mess. That's a mess that's going on. The rates are going up, prescriptions are going up, right? Addictions are going up. All of that stuff is a mess. You guys recognize that. So there's got to be a better way. So we're going to start with the health equation, okay? So the environment that you place the children in and the lifestyle that you expose them to causes a genetic expression. So is there a genetic component? It's fair enough to say, yeah, there is. But are they genetically predetermined to have ADHD? No, absolutely, absolutely not. The environment that you place them in and the lifestyle that you expose them to determines their genetic expression. All right, so I'm going to give you an example of how their environment relates to their genes. All right, so there's a chef and his name's Mike, right? Mike's got this recipe book that he makes some delicious, foods. We all love that. And so he packed it up and he went to Italy and he sat down and he's looking around at the environment. He's like, man, these people would really love some spaghetti and meatballs and some red marinara sauce, right? So he opened up his recipe book. He found that recipe, all right? He read the recipe and he made that meal and people loved it. It was great. He was a hit, all right? So then he packed that up and he got on a plane and he went to the Caribbean and he looked around at the people and he goes, man, these people would love some jerk chicken and some rice and beans. Right? So he opened up his recipe book and he found that recipe. He read that recipe and he made that meal for those people and they loved it. Okay? Then he went back home to America and he looked around and he goes, man, these people would really love some macaroni and cheese and some hot dogs. Okay? So he flipped to that recipe and he read the recipe and he made the macaroni and cheese and hot dogs and people loved it. All right? So the question is did the recipe book determine what was made? Did Mike determine what was made? Or did the environment determine what was made, right? So it's the same thing with our genes. It's what we place our genes into determines the environment that we place those genes into determines the expression of those. Now where you guys as adults have the most influence is with the lifestyle choices. All right, so here's an example of how lifestyle choices relate to your genes. So I've got this blueprint for my dream home. All right, it's going to be a phenomenal house, but I'm really cheap, okay? So I hire some cheap workers and some rusty screws and a bad hammer, bad glue, bad nails, they're crooked, you know what I mean? And I build this house, and I get a poor house out of it. It was my dream home, had a lot of potential, but I get a poor house out of it, right? There's constant maintenance, things are breaking. But then I look at the same blueprints, and I'm like, man, I'm going to have my dream home. I'm going to wait an extra year so I can buy all the right materials. So I buy the best materials, and I get this great house, right? I've got good glue, good wood, good screws, good hammer, good nails, good paint, you name it. I'm just top of the line with this. And I get a phenomenal house. Nothing breaks. I don't have to do any maintenance or anything like that, all right? So did the blueprints change? No, they stayed the same, right? Those blueprints represented potential, right? You guys following me? So, again, the environment that we place these children in and the lifestyle choices that we expose them is the best way to predict the health outcomes. So this is a paradigm shift, right? This is going from my genes control everything, that's my destiny, to, oh, I really do have some control. I just have to make some better choices. This is a paradigm shift. And people out there, they're being lied to. They're being lied to because they don't know this. They don't know that they have choices that are going to better predict their health outcomes. They don't know that. So chiropractic, specifically, how does chiropractic help these kids? Well, in chiropractic, we look for a condition along the spine called subluxation. And subluxation is a movement deficiency syndrome. All right, so subluxation, this is a longer definition, but it's a complex of functional and or structural and or pathological changes to the joints along the spine. This compromises neural integrity and it's detrimental to organ system function and overall health. All right, so that's a mouthful right there, but so let me unpack that a little bit. I know this is a review for you guys, but I don't want you guys to forget anything, right? Your master system is your nervous system. Yep, your brain, your spinal cord, the nerves that leave your spine, right? That's your master system, right? Your brain's in constant communication with your body, and all that information courses from the brain across the spinal cord out these nerve roots to every tissue, organ system, every gland in your body, okay? It's that communication that keeps you healthy. It's how all your healing happens. It's why you're able to hear me tonight. It's why you're able to formulate memories. It's why you're able to suppress distracting noises like the AC unit and pay attention to me. It's how you suppress your thoughts so you can pay attention to me, right? So you have neurological control over your attention. It's the seat of all of your emotions. It's the seat of all of your thoughts, all of your behaviors. It's your nervous system, okay, where all of that resides. In your spine, which is your suit of armor, protects that nervous system, right? So your spine does two things. So your nervous system is that really soft tissue. It's the softest tissue in the body, right? And it's wrapped around or encased in bone, which is the hardest tissue in the body, right? So this spinal column does two things. It protects that nervous system and allows for movement, okay? So your brain's the most important organ in your body. Sister Marie already told us that. So we know that because it's encased in bone, right? And then the brain forms into the brainstem, and then that continues as the spinal cord, which goes down this tube of bones. All right, if I were to straighten all this out and look down, there's a tube it makes a tube here for that spinal cord to go down. So the spine, because it allows movement, is made up of an intricate network of joints, right? And a joint is made up of a bone, a disc, and another bone, and there's facets back here as well that allow movement back there. So subluxation occurs when one of these spinal bones is jarred out of a healthy alignment, okay? That creates soft tissue damage. There's inflammation and irritation to the nervous system, okay? When you have a movement deficiency along your spinal column, it sends a toxic nutrient to the brain. It's called nociception, okay? And we're going to get to why that is important here in 1 second. All right, so a movement deficiency syndrome. That's what I want you guys to remember right now. So, why is that important? Because attention deficit hyperactivity disorder, it stems from a malfunction of the brain's attention system. Okay, a malfunction in the brain's attention system, which is a diffuse linkage of neurons that hitches together areas controlling arousal, motivation, reward, executive function, and movement. So in other words, there's all these different areas throughout the brain and the brainstem that are all connected by neurons. And that intricate network makes up your attention system. So movement and attention, they share overlapping pathways in the brain. Movement coordinates the flow of information smoothly through the attention centers. So there is an intimate relationship with your ability to pay attention, focus, learn, to make for executive function and to make decisions. There's an intimate relationship with that and how well your body is moving, how well your spine is moving in particular. And this is it, right here. This is Chiropractic 1303, not Chiropractic 101. All right, we're not going to go over this, but because it would take a very full weekend to do so. But what I want you to know is that this is the spine right here, okay? These two. And all of the red arrows represent subluxation or movement deficiency along the spine. And what I want you to see is that movement deficiency in the spine communicates with the spinal cord, and then it goes to all these areas in the brain. That's how it affects your neurology. That's how it affects everything that you do. It can affect energy levels, stress levels. The blue, proprioception, is the chiropractic adjustment and the restoration of proper movement along the spine, shows how that goes and affects the brain. But really what I want to point out with this is that all of the red arrows, that nociception or subluxation that gets sent to the brain, what it does is it decreases memory, it decreases concentration, it decreases your ability to learn, it increases stress, anxiety, fear, and depression, it decreases immune function, it decreases organ function, and it decreases rational decision making. All right? Conversely, the blue arrows that represent the restoration or the adjustment of those subluxations result in increased memory, increased concentration, increased ability to learn, decreased stress, decreased anxiety, fear, depression, increased immune function, increased organ function, and increased rational decision making. Right? So you can see how this plays out in ADHD, right? How chiropractic neurology can absolutely help kids with attention deficit hyperactivity disorders. This is it right here. This is the diagram. This is chiropractic neurology and how that works. All right. So how do we correct subluxations? Well, it's like the fuse box. When you go home and you go into your kitchen and you turn on the light and the light doesn't work, and you open the fridge and it's warm, and you turn the oven on, it doesn't heat up, and the toaster's not working. You're not going to call a repairman and tinker with the toaster and get a new light fixture, right? You're not going to do all those things. You're going to go down the stairs into the basement, find the fuse box, find the switch that's been turned off, and turn it back on, restoring proper communication to that kitchen and to that house, right? So it's the same thing in chiropractic. When a child comes in and he's got dyslexia, dyspraxia, when he's got depression, when he's got attention deficit hyperactivity disorder, right? We're not going to go tinker with all those different disorders and all the different neurotransmitters in the brain and all the different brain systems, right? We're going to look for areas of inflammation along the spine that are causing a movement deficiency in adaptive physiology, and we're going to correct that through the chiropractic adjustment, okay? And we're going to administer those adjustments in rhythm. We're going to break the bad habits that are contributing to those subluxations, and we're going to teach children and adults exercises and movement patterns to strengthen the spine, okay? So what causes subluxation in kids? Well, pretty much the same thing that causes subluxation in adults. But with kids, they're way more rambunctious, right? So traumas make sense. Falling off a skateboard, off a bike, accidents, falling out of a tree, that makes sense. But what we find much more commonly is it's our bad habits. It's the things that we do on a daily basis that promote our subluxation patterns, all right? So sedentary living, watching TV too much, playing video games, and poor posture, all right? The traumas make sense. Feeding kids toxic fluids, feeding kids toxic foods, right? And even bullying, right? Fear, anxiety, stress for these kids mentally and emotionally lead to subluxations along the spine. And I've got a diagram to show you how all those thoughts, traumas, and toxins lead to subluxation along the spine and drive these kids into an adaptive physiology. The first subluxation most commonly in this country, thank you for laughing at that, happens at birth, right? When you look around the world, 90% of the world, they do birthing much different than we do in this country, right? When you look around the world, mom's going to be in a squatting position, okay? Gravity's going to be working with her. Being in a squatting position opens up the pelvic cavity and prepares the birth canal for birth, right? It places the proper tone on all the muscles of the uterus and the pelvic floor. But in our modern wisdom, what do? We put mom on her back, right? We close down the birth canal. We take away the proper tone to those muscles, okay? We take away gravity. So mom has to push harder, so that makes the whole delivery much harder, much more painful. So then we give an epidural, so mom's numb from the waist down. She can't feel anything, so she can't push appropriately. So then we give her Pitocin. There's abnormal uterine contractions, right? It's just this thing that just keeps going and it trickles, right? So mom does less pushing, doctor does more twisting and pulling, and if that doesn't work, we've got forceps that we use, we've got suction cups that we use, right? And if none of that works, And right, we've got C-section, which has been graded as a grade 2 whiplash injury, right? It's not cut open, pull the baby out. It's a traumatic process, right? And most of that trauma takes place at the top of that baby's spine, at the base of their skull, where their skull meets the neck, right? And that's where a lot of those centers for arousal are seated in the brainstem, okay? So guys, we need you to understand why we see kids. Like, we know we can help kids with things, right? We know we can help kids with attention deficit hyperactivity disorder, right? We make it our highest priority to check them because tonight's all about potential, and it's all about helping these kids reach their greatest potential and develop healthy, right? Develop optimally. That's what we're about in this office. So, some practical things that we can do concerning the way that these kids eat, move, and think. Some practical things that we can do, specifically with attention deficit hyperactivity disorder. So here's the diagram that I was referring to, how toxic and deficient thinking comes in, and there's a cortisone release, and there's a hormone cascade, and it trickles all the way down to you have subluxation, neurological movement deficiency, which leads to chronic disease and sickness. Toxic and deficient nutrition comes in up here. It's the same cascade all the way down to subluxation and to chronic sickness. Toxic and deficient movement, the one that makes sense to everybody, comes in right here, leads to neurological interference, which leads to chronic sickness. So the way that you eat, the way that you move, and the way that you think, if those are toxic and deficient lifestyle choices, that's going to promote subluxation along the spine, okay? So with these kids, what do we need to do with them, right? We need to ramp up their activity, all right? We need to ramp up their movement. You know we have a sedentary lifestyle. We've got more commuting now. They're sitting in school more. We've got less recess, okay? And we've got more electronics. We need to get these kids moving. If you think they're moving enough, add 2 hours a day, right, to how much they're moving, all right? And it's not so much about sport. They don't have to be in sports. But we do know that when these kids are moving physically and they're doing an activity that also requires brain activity, they have better outcomes, right? They have better outcomes. So things like martial arts. So you're doing martial arts, but you're also thinking, man, I better not get hit in the face. It's going to hurt. So you're going to defend yourself. There's a lot of thought that goes into that. Gymnastics is a high level of skill. CrossFit. CrossFit is huge for kids because it takes respiratory endurance, strength, stamina, speed, balance, agility, coordination, accuracy, all of those things wrapped up in one. There's a lot of skill that goes into Olympic lifts, into gymnastics. These kids need to be CrossFitting, right? They need to be doing these high-level thinking skills, not necessarily the sports that you normally think about, okay? But we got to get them moving more. Got to get them moving more. So think about exertion and not just exercise as well. So a lot of us we've gone through seasons where we go to the gym to exercise, and then you walk away thinking, I didn't really do anything, right? So you got on a treadmill and it really wasn't exertion, but you did exercise, so right, you can eat your brownie for the day. All right, so with the electronics these days, it's a huge problem. It's a huge problem for these kids. So in 1990, we saw a huge, the trend of ADHD really start to skyrocket. What else happened in 1990, right? Computers, video games, handheld devices. And I'm not talking about Atari that's real slow, right? I'm talking about stuff with some cool graphics, really fast-paced games, right? So kids started sitting in front of these electronics, and their body is still, but their mind is like racing as they're watching these pictures, right? They're in their formative years. So in other words, the wires are being formed in their brain. They're being taught how to think, right? Your forming behaviors in those formative years happens all the way to about the age of 20. So an example of that is someone with an Irish accent versus someone with, a Boston accent. The two different accents. If you rescue somebody from, not rescue, but if somebody leaves Ireland early enough and they come over here, then they won't necessarily have an Irish accent the rest of their life because the wires up here haven't completely formed, right? But during those formative years, we got to reduce the amount of video games that they're seeing, right? So they got this crazy activity. Then you take them out of that environment and you put them in a school environment, right? And all their mind wants to do is go crazy because that's what they're used to seeing, right? And so they start misbehaving, they're intruding, they're hyperactive, they're fidgeting. All right, so the other things that the electronics do is they decrease the amount of sleep and the quality of sleep that these children are able to have and able to get. So we already know that we're kind of deficient in sleep as America. compared to other countries, but children too, right? So what happens is we've got these handheld devices, the phones, and we've got the computers, and we've got the monitors and the screens. Well, all that bright light right before you're going to bed inhibits the release of melatonin, and melatonin is the hormone that allows you to enter deep sleep. Okay, so you're seeing all those bright lights, your brain thinks it's still daylight out. You don't want to go to sleep, right? So the delta wave, which is that deep, rejuvenating sleep, is what the kids are lacking because of these electronics. Okay, and when they don't get enough sleep, what happens? They get stressed. They get stressed. So what's really cool, I came to, as I was studying this, I realized that PE, right, or physical education, I don't know that they thought about this when they made that term up, but really it's an inseparable term, physical education. The biology of maturing, how a person goes from a young person into being able to think more clearly and being more mature, is all about the development of the prefrontal cortex. That's where your executive function takes place. And the only way that that can develop sufficiently is with a proper amount of movement, physicality. These kids have to move in order to mature. So these toxic, movement deficiency patterns, the lifestyle and subluxation, really what that's doing is that is inhibiting the maturation of the prefrontal cortex where all executive decision making takes place. Does that make sense, everyone?
Yes.
All right, so in terms of how they eat, be thinking about nutrition, not diet. So diet is something that you get onto and then you get off. You get onto and you get off. We've all gone through that. I've seen parents do it with their children as well. Nutrition is about lifestyle. It's about adopting a way of thinking about food. It's how you're gonna raise these kids to eat and hopefully let them eat the rest of their life. Nutrition is all about lifestyle choices and not just getting on something to overcome something or to lose weight. Think about nutrition. Think about good sources of food and not rich sources of food. And so milk is a rich source of calcium, but it is a poor source of calcium for us, right? It's got tons of calcium, but what it actually does is leach calcium from our bones,
Why?
right? So
Lots of milk.
So let's talk about that afterwards, because I would love to address that with you.
Yeah.
Would love to talk to you about that.
Love milk. I'm addicted to it.
So think quality versus quantity, right? So a handful of lettuce, or excuse me, a handful of spinach is going to provide you a ton of vitamins and minerals. How many heads of iceberg lettuce do you think it would take to get the same thing? I don't know. 23, 50, 100, I don't know what it is, right? So we already know that our country's kind of overfed, right? It's because the foods that we're eating are a poor source of nutrients. So when you're making food decisions, when you're preparing meals for these children, think about the quality of food, not just the quantity. I would much rather, for my children are not going to starve by any means, but they're not going to overeat. In the foods that they do eat, I'm going to err on the side of maybe they had 100 less calories, but the calories that they did have were nutrient packed. That's going to be my philosophy, right? So pesticides have been linked to attention deficit hyperactivity disorder. So you've got to get rid of the pesticides. You got to go organic or try to go as organic as possible. Get rid of the artificial flavorings, the artificial colorings, right? Artificial, anything artificial. You got to get rid of that. Neurotoxins like the sweeteners, right? Splenda, NutraSweet, all of that stuff. It's got neurotoxin into it right now, and it disturbs the neurology in the children. Foods that are inflammatory, again, we've got dairy. Sorry, anything that's white, white flour, white bread, white sugar, white fluid, whatever it is, you gotta get that out of the diet. Increase the fiber content, and just know that bugs and dirt, they're our friends. They're our friends. We have to be exposed to plenty of dirt, plenty of bugs to develop properly, especially our immune system, but also our nervous system. So don't over-sanitize everything, right? I'm surprised that people aren't putting hand sanitizer on these kids' toothbrushes when they're brushing their teeth. It's that's ridiculous, all right? And again, subluxation, have them checked for subluxations because a toxic and deficient nutrition will lead to subluxation. All right, how about the way that they think? So this is big, right? So we got to get really good at affirmation and not correction. So when we're constantly correcting a child, we're forming a neurological network in there that kind of always leads them to those behaviors that crave for the correction or that attention, right? These are formative years again. When we affirm a child and we tell them we love them, man, that's great, do more of that. When we feed that area of the brain, they're naturally going to want to gravitate towards that. So we just have to become more disciplined and better at that. I know sometimes it's frustrating, right? With these kids, you know, they're hyperactive, they're rambunctious, they're kids, they're bouncing off the walls. I'm not going to talk to you guys about patience. I know you guys have plenty of patience, but really that's about responding appropriately to kids and not reacting to a certain behavior because it disrupts our day. We want to respond appropriately to them because it's all about affirming them, it's about their growth. And that takes a tremendous amount of patience. And when you demonstrate that patience to them, you model something for them because they're learning from you. They're their caregiver, right? These kids have a special connection with mom and dad. So when you model patience, okay, not only towards them, but in everything else in life, they're watching, right? Then you're teaching them to be more patient because they want to emulate you. Clarity versus confusion. Create clarity for these kids through structure and through routine. You've got to be vigilant about this because if they do have extra energy, right, they need to know how to predict and they need to know what to expect on a daily basis of how to channel that energy, right? So when are they allowed to unleash that? So we can teach them when that is throughout the days if we're consistent with the structure that we give them in the routine, okay? So a couple things that you can do. Teach these children to communicate through touch, right? Especially if you've got a child who interrupts all the time, they intrude on conversations. Teach them to come over and put their hand on your arm. So one, they know that they've now captured your attention, okay? That they've communicated with you without intruding the conversation. Then you turn and you look and say, "Thank you, Tommy. I'm going to finish this conversation really quick and I'll be right back with you." Okay, so they know now that they've captured your attention without intruding a conversation, all right? So communication with touch. Talked about routine and modeling. A couple other coaching things that I learned is get it, got it, good, all right? Tommy, go put your shoes up. Tommy, go put your shoes up. Did you get that? Got it, I'll go put my shoes up. Good, okay? For everything. Tommy, do the dishes. Did you get that? Got it. I'll do the dishes. Good. So what this does, when you communicate something to a child and you ask them a question afterwards, it forces them to integrate that information, to think about it, and then to give a response. So it's teaching them how to properly communicate with authority, with other people, right? It's a really cool process for these kids to learn how to communicate and communicate clearly. And then what else? So motor mouths, right? We've all been called a motor mouth before at some point in our life. So we get home and we want to tell mom and dad everything that happened or the frustrations or this happened, that happened, whatever. So what you want to do in this place is say, "Man, I can understand how that's really frustrating, Tommy. What else? Oh, I remember when that happened to me when I was, your age. What else?" So let them get everything out, right? Let them get everything out. Exhaust them getting it out by asking them, what else? What else? What else? So again, this is teaching them how to get really clear with their communication and how to communicate clearly. My brother and sister do this so well with their children, with my niece and two nephews. They do it so well. They are really intentional about spending time with them and asking them, what else? And it really works. They're super patient kids. All right. So if you guys are walking around and friends or family, and they've got children that sound like this. So do me a favor, let's all say this together, okay? Ready? Ask me about my ADD, or pie, or my cat, a dog. I have a bike. Do you like TV? I saw a rock. Hi. Right? Like off the walls. Like how many different things can you juggle into one sentence? All right? But we all know some children that sound like this, okay? And if this gets too if kids are doing this too much, right, just know that chiropractic can help them, okay? We're about pediatric development in this office, all right? So that wraps up tonight. If you can think of any children, have them contact the office if there's anything that we can do for them. So I appreciate your guys' attention tonight and you being here. Thank you.